Paracetamol and ibuprofen are two of the most commonly used painkillers around the world. But have you ever wondered what really happens when you take them together? In this video, we're going to uncover 7 big effects that you need to know before combining these medicines. Don't worry, we'll keep everything simple, clear, and easy to understand so you can make informed choices about your health. Effect 1. Faster pain relief. When it comes to pain, time matters. Taking paracetamol alone can ease your headache, while ibuprofen works well for muscle or joint pain. But when you combine them, something interesting happens. Your body gets relief faster. That's because they act on different pathways in your nervous system. Paracetamol works mainly in the brain to reduce pain signals, while ibuprofen targets inflammation at the source. Together, they attack pain from 2 directions, making the effect stronger and quicker. It's like having a 2-pronged attack on your discomfort. People often feel surprised at just how fast they notice the difference. But here's the catch. Faster relief doesn't mean it's risk-free. You still need to be careful about the dose and timing. Taking too much too often can be dangerous. So, while the combination can be a powerful tool for short-term relief, it's not something to use without understanding the limits. Knowing how your body responds and following safe guidelines makes all the difference between effective relief and unintended harm. Effect 2. Reduces fever. Effectively. Fever is your body's way of fighting infections, but sometimes it can be uncomfortable or even dangerous. Both paracetamol and ibuprofen lower fever, but in slightly different ways. Paracetamol works mainly in the brain to reset your body's temperature, while ibuprofen reduces inflammation that may be causing the fever. When taken together, they can reduce high fever faster than either one alone. Many people are shocked to discover how much more efficient this combination can be, especially in cases of stubborn fevers. But here's the warning. Just because it works faster doesn't mean you can take more than recommended. Overusing either medicine can lead to liver, stomach, or kidney problems. This combination should be used carefully, particularly in children, elderly people, or anyone with other health conditions. Understanding how each drug works and respecting safe limits can help you manage fever effectively without putting your body at unnecessary risk. Quick relief is satisfying, but safety always comes first. Effect 3. Risk of stomach problems. Here's something many people don't realize. Ibuprofen can be harsh on your stomach. It may cause irritation, heartburn, or even ulcers if used frequently. You might think that adding paracetamol could balance it out, but it doesn't. Paracetamol is easier on the stomach, yes, but it doesn't cancel the effects of ibuprofen. So, when you take both, you could still be putting your digestive system at risk. This is shocking for many who assume that combining 2 common painkillers is automatically safe. Stomach pain, nausea, or worse, can sneak up if doses are not monitored. People often ignore early warning signs, thinking it's just a little discomfort. But over time, frequent use can lead to serious issues like bleeding or ulcers. Simple precautions like taking ibuprofen with food, avoiding high doses, and limiting frequency can make a huge difference. Awareness is key. Combining painkillers can be effective, but ignoring your stomach's response could turn a helpful routine into a painful problem. Effect 4. Liver concerns. Paracetamol is safe age-recommended doses, but high doses can strain your liver sometimes without obvious symptoms at first. The scary part? Many people combine it with ibuprofen thinking they're doubling the effect safely. While ibuprofen mainly affects the stomach and kidneys, the liver still has to process paracetamol. Taking both, especially in high amounts or over several days, increases the risk of liver damage. This can sneak up silently, making it shocking for those wholly on these drugs frequently. Signs like fatigue, yellowing skin, or nausea may appear too late. People often think it's just a headache or fever, not realizing that repeated misuse can harm vital organs. The key is awareness. Track how much paracetamol you take, respect maximum daily limits, and avoid combining without proper guidance. Your liver works hard to keep you healthy. Overloading it with medications may seem harmless at first, but the consequences can be serious. Treat it carefully, because what feels like relief today could cause serious harm tomorrow. Effect 5. Kidney stress. Ibuprofen can quietly affect your kidneys, especially if taken frequently or in high doses. For many, this is a shocking revelation, because the kidneys don't usually cause pain until there's a problem. When you combine ibuprofen with paracetamol, the risk doesn't disappear. Paracetamol is gentler on kidneys, but it doesn't undo the effects of ibuprofen. Over time, this combination can put extra stress on these essential organs, affecting their ability to filter waste from your blood. People with pre-existing kidney issues, high blood pressure, or dehydration are even more at risk. The scary part is that kidney damage can be silent at first. You may feel fine while your kidneys are slowly being strained. Drinking enough water, avoiding long-term high doses, and monitoring your health are crucial. Understanding that even over-the-counter medicines can stress your body is eye-opening. Safe use means respecting limits, alternating medications carefully, and never assuming common drugs are automatically harmless. Effect 6. Anti-inflammatory boost. Ibuprofen has an anti-inflammatory effect that paracetamol does not. This makes the combination particularly powerful for pain caused by inflammation, like sore muscles or joint pain. Many people are amazed at how well the combination can reduce both pain and swelling at the same time. It's almost like getting a double advantage. Ibuprofen tackles inflammation, while paracetamol eases the pain signal in your brain. However, the shocking truth is that this effectiveness can tempt people to take more than safe limits. Overuse can lead to stomach, liver, or kidney issues we talked about earlier. So while the anti-inflammatory boost is impressive, it's a reminder that power comes with responsibility. Use it wisely, and you can get faster relief. Abuse it, and the very organs keeping you healthy could be at risk. This combination is strong, but only when used carefully. Effect 7. Safe. Only in correct dose. No matter how effective, paracetamol and ibuprofen are only safe when taken in the correct dose. Exceeding recommended limits can cause severe liver, stomach, or kidney damage, sometimes even life-threatening. Many people are shocked when they learn that something so common can become so dangerous so quickly. The body can only handle a certain amount at a time, and combining these medicines doesn't change that limit. Even short-term misuse can have consequences. Understanding the maximum daily doses, spacing the medicines correctly, and paying attention to warnings is essential. The good news is, when used properly, this combination can be a safe and effective way to manage pain and fever. But the key takeaway is simple: never assume more is better. Respect the limits, follow guidelines, and always prioritize your health over fast relief. To sum it up, paracetamol and ibuprofen can be powerful when used together, giving faster pain relief, reducing fever, and even helping with inflammation. But this power comes with risks, from stomach irritation and liver strain to kidney stress if doses aren't carefully monitored. The key takeaway is simple: always follow recommended limits and use these medicines responsibly. Quick relief is tempting, but your health is more important. Remember, when used correctly, this combination can be safe and effective, but misuse can lead to serious problems. Stay informed, respect the doses, and your body will thank you.